7:43, welcome back to Go. Back to school season right around the corner. And with that comes those icky germs that kids can pick up in the classroom. That's why we're bringing in senior health correspondent Monica Robbins to break down what you need to know about this year's recommended back to school vaccines. Monica, fill us in.
Oh, thank you, Danita. Good morning. There has been quite a lot of confusing information out there about vaccines, and we wanted to break it down in simplest terms. So joining me now is infectious disease specialist Dr. Amy Edwards from Rainbow Babies and Children's Hospital, and she is also president-elect of the Infectious Diseases Society of Ohio. Thank you so much for being here.
Thank you for having me.
I know you have to be getting so many questions from parents, especially with all the information that's going on out there about changes in vaccine recommendations, but what do you want them to know before sending kids back to school?
Right now, the American Academy of Pediatrics and the Infectious Disease Society of America have made no changes to their recommendation in what vaccines children should have before they go to school.
So what changes have they been hearing about that have been causing all the confusion?
Well, there's a lot of things. So they changed recommendations around the COVID vaccine, for instance. There's been some questions raised by the Department of Health and Human Services around the MMR vaccine. And there's even been some rumblings about like school mandates and whether you can require kids to have vaccines before attending school. But as of right now, other than the COVID vaccine, no changes have been made by the federal government, and the AAP and the IDSA have made no changes, even to their recommendations for the COVID vaccine.
So in your opinion, are there any vaccinations kids can skip and be okay?
That's an interesting question. The short answer is no, not really. The long answer is everything is about risk, right? I don't know in my magic crystal ball which kid is going to have a bad outcome from COVID, which kid's going to have a bad outcome from measles. So could a kid skip a vaccine and theoretically be okay? Sure, if they're lucky, but you're rolling dice with your kid's health. So kids should be up to date on all of their vaccines. If you have questions, especially for kids with health issues that you worry about, could vaccines interact with that, talk to your pediatrician. But except for in a very few rare cases, all children really should be fully up to date with their vaccines.
A lot of people are saying, well, measles, we can take care of that now. But now we have never seen measles cases this high in any recent history.
Well, and can we take care of, people die from measles. And sure, it's only 1 out of every 1,000 cases of kids who die from measles, but is that a risk you're really willing to take? And then even if you survive, you're talking about risk of deafness, risk of blindness, risk of brain damage. Measles virus is actually one of those viruses that can damage your immune system. So people who have measles have higher risk of dying from infection in the future because it's damaged their immune system. There's a whole host of medical problems that can come out of a measles infection. So this idea that we can be okay with some of these viruses or bacteria now because we have modern medical technology just isn't true. It can still do a tremendous amount of damage.
Vaccines aren't just for the child, though, right?
Absolutely. The vaccines are for all of us. So you think about people who have compromised immune systems, people who have had cancer, people who have had transplants, organ transplants, bone marrow transplants, people who have autoimmune disease and have to be on immune suppressants. They can be vaccinated, but a lot of times the vaccines don't work very well in them. There are, in very rare cases, medical conditions that don't necessarily allow for vaccination. And so there are vulnerable people that live in this society that rely on us to be vaccinated to limit the spread of these diseases that can harm them. Also babies, very young babies, babies under the age of 2 months aren't vaccinated. Babies under the age of 6 months aren't vaccinated for influenza. These smallest children rely on us, to keep them safe. And then you think about the elderly. As you get older, even if you are vaccinated, your immune system develops something called immune senescence, meaning it starts to forget how to work. So if we're not vaccinated and diseases are spreading, then the elderly are also at risk. So it's, the thing about living in a modern society is that we all work together to help and protect each other. That's one of the hallmarks of civilized society. And I think vaccinations are a cornerstone of that.
Real quickly, your message to people who may have a fear of vaccines or who are adamantly opposed.
One, I would say, just because you've heard it on the internet or even from the Department of Health and Human Services doesn't mean it's necessarily true. Talk to your pediatrician, talk to a medical provider that you trust about your child's specific issues, your specific concerns, and get the facts, not just, you know, misinformation spread online.
From one source.
From one source that you trust.
All right. Amy Edwards, thank you so much, doctor. I appreciate your time. All right, Danita, back to you.
All right, really good information we needed to know. Thank you, Monica.